On March 30th, 2011, AIDS.gov spoke with Deborah Parham Hopson, the Associate Administrator for the HIV/AIDS Bureau with the Health Resources and Services Administration, or HRSA, about many elements of the Ryan White program, including the AIDS Drug Assistance Program.
Well, the AIDS Drug Assistance Program, or ADAP, is the safety net program providing medications for people who are living with HIV. In 2009, we provided over 200,000 people with medications through the ADAP program. So for the most part, the ADAP program is sound. But we do know that there are some challenges that have led to the waiting list that people keep hearing about. One of the reasons that there are people on the waiting list is because there's increased testing, and so we're finding people who are HIV positive and getting them into care. We also know that people are living longer, and as they live longer, they stay in the ADAP program longer. And also, the PHS guidelines for treatment have recommended that we really look at when we start treating people with HIV, and therefore people get their medications earlier in the course of the disease than they may have before. We also know that the states are facing fiscal challenges and have not been able to contribute as much money to the ADAP program as they may have in the past. And finally, people are losing employment, therefore they lose their insurance and become eligible for the ADAP program. So when you combine all of these factors, we know that that has contributed to these waiting lists that we see in the states, in some of the states, the 10 states that now have waiting lists. Now, while they're waiting for the program, we do work with them to assure that they do have access to medications, oftentimes through the pharmaceutical assistance programs. So while they're waiting for ADAP, they're not necessarily waiting for medications. And that's a message that I really want to make sure that we emphasize, that people do know that even though there are these waiting lists, that people do have access to medications.